Hi, everyone. Welcome to our second episode of Accessible Futures Live. I am your host, Samantha Van Scoik. I am the Vice President of Strategic Partnerships for CIL. CIL is a nonprofit real estate developer. We specialize in partnering with home and community-based service providers to develop community residences. And we do this by securing 100% financing for the project, managing any necessary renovation or construction, and leasing it back to the provider over a long-term lease, a long-term capital lease. And the thing that makes us different from other developers is that we donate the home to the provider at the end of the lease term. So if you want to learn more about who we are and what we do, I encourage you to check out our website at cil.org. And just for the purposes of a quick visual description, I am a white woman with long brown hair, wearing a black shirt. Quick note on accessibility. We are very pleased to have DeAndre with us today for live ASL interpretation. Depending on which platform you're viewing the series from, you might also have access to live captioning. So we are always trying to make our content more accessible. So let us know if there's anything we can improve on. And today we are here to talk about universal design, what it is, how we can implement it, and why we should. So but before we bring on Carrie to talk about that, we've got one note for our live viewers. We are on a 30-second delay. So if you have questions, drop them in the chat whenever the question comes to you, and we will take the question as we can. So without further ado, today we are joined by Carrie May, who is a great friend and former coworker, and currently serves as the Global Practice Leader of Pediatrics and Women's Health at Canon Design. Carrie, thank you for being here.
Well, thank you for having me, Sam. And hi, everyone. I'm so thrilled to be here and genuinely honored to participate in such an important conversation. These are topics that we don't talk about enough, quite honestly. And as an architect by background, I am emphasizing that I am also a mom and a sister and an auntie and a friend and a human at the end of the day. And these are things that all contribute to how we approach the built environment, how we view the world. And universal design is really the root of how we think about the lens that addresses everyone's needs.
I love that. Carrie, can you start by sharing a little bit about your background and what led you to focus on universal design in healthcare and beyond?
Yeah, I appreciate the question. And I think there's a lot of different moments in my life that I can point to and say, this is why I do what I do. But I had this really impactful part of my early career where I worked on my first healthcare project. And all things considered, it was actually a really small project. It was a renovation, but it was an oncology infusion suite. And we were taking a small suite from a really, kind of unfortunate basement location where they had almost no access to natural light or views. And we were moving them to the top floor of the same building. That was really a space that was light filled and airy and gave them an environment that they could truly thrive in. And at the ribbon cutting for that ceremony, I actually had a patient approach me after the speeches were done. And she told me that I was the reason that she was going to beat cancer. And I just knew in that moment that I could never do anything else. And that I had really found my calling. The concept of designing with empathy and understanding where people are coming from, and building environments that support that journey for them wherever they are is just something that really drives who I am and what I do.
Chills. So, Carrie, I know you've worked in architecture as an architect, and then also for hospital systems and hospital planning, and executive leadership. So how has that experience formed your perspective on universal and inclusive design?
Yeah, I emphasize this one a lot now at this stage in my career. It is one thing to be an architect and a designer and to put the ideas on paper and send it off to a contractor and kind of walk away after the ribbon cutting because you've done your job. It is a totally different thing to then be the person that lives in that environment, to see how people are interacting with it, to understand what's not working well, to understand the maintenance aspect of it and what it takes to keep a healthcare function operational 24/7, and the financial repercussions of downtime if you need to fix something that's broken, and just the intuitive things that maybe architects don't get a lens into because they are not clinicians. Mm-hmm. So working alongside of the people that are providing the care and the spaces that you're creating, and then, you know, almost more importantly, seeing how, in my case, the pediatric population was interacting with the environment was also really eye-opening to me. I found that in the environments where the spaces weren't built for kids, they still found a way to be kids in their own way, and they would make games up and they would kind of change the physical environment to suit whatever their imagination showed them at that time. And it just really drove me to a place of we can do better. And this is why I'm here, because seeing situations like, you know, a child kind of playing a game of the floor is lava on unintentional, you know, color changes makes you realize that you have so much more influence in the way that someone can perceive the space than you realize as a designer.
I love that. The floor is lava. That's great. So universal design is a term that we hear a lot, and I think it's often misunderstood.
Yeah.
How do you define universal design, and what does it mean in practice?
I think that there's a lot of different ways that you can look at universal design and, you know, the kind of Webster dictionary definition of it. But to me, it comes down to equity. And it's really important to understand the difference even between equity and equality, because they're not the same thing. And the idea of meeting the patient or the provider where they're at in that moment and giving them exactly what they need is different than giving everybody the same thing. Mm-hmm. And understanding that the nuance there is as simple as, I like to use the reference of a fence and, you know, 3 different people trying to watch a baseball game. So you have, you know, a 6 foot tall, you know, average male who can just barely see over the fence with no help. And then next to him, you have maybe an average height woman at 5'4" who can't see over the fence at all. And then next to her, you have a child who is, you know, under 4 feet tall and can't see anything, can't even see over the bush in front of the fence. If we're talking about equality, we gave all 3 of them a stepladder. And at the end of the day, maybe the 6 foot tall male is actually the only one who can see well, because the other 2, even though it raised their viewing height, it didn't raise it enough for what they needed in that moment. Mm-hmm. And so when we talk about equity versus equality, equity brings the right height stepladder to the right person at the right time so that they can get the services they need. So when we think about equity and universal design, how are we building intuitive spaces that allow for people to be who they are and their authentic self, and not asking them to adapt to an environment that wasn't built for them.
Yep. And that's, I think, feeds perfectly into the next question we have here. Like, some people say universal design is just meeting ADA standards. Mm. That's not right. So, I mean, you've touched on this. Why is it more than just compliance?
Yeah, I think that what you also have to understand when you talk about compliance is a bare minimum. Yeah. It's literally like the squeak by and do as little as you can to meet the needs of a very diverse population. And quite frankly, it's not enough. Mm-hmm. Because if you follow the compliance regulations, you're doing things like, okay, I've got to make my doorway wide enough for a wheelchair to get through. But you're not thinking about things like the neurodiverse child who is really sensitive to noise and sensory tactile environments. And so the way that that child interacts with even opening the door or the door opening by itself can have a profound impact on that child's experience. The colors on the wall can change the way that that child feels about the environment. There are things like noises and environmental controls that can all influence and shape how somebody perceives their space in the world. And if we're not thinking about all of those elements, we're doing our patients and our population a true injustice, because nobody sees the world through the exact same lens. And by looking at compliance minimums and doorway widths, sure, we're making things a tiny bit easier for the population that happens to be in a wheelchair, for example. But what about the population that's, mobility impaired in different ways, that they have, maybe crutches, for example, and they interact with that door in a different way than somebody in a wheelchair would. So navigating the environment is only one piece of the puzzle. And that's really all the code tries to address, is making things slightly less barrier impeding. And it really doesn't do enough.
Yeah. So how do you, as a planner, as an architect, like, how do you address all of those different needs? Like, what is the approach?
I mean, that's a loaded question. What's your approach? I think, every project is certainly unique. Yeah. I can think about one particular project that Canon Design was involved with. That was, I just used the example of a neurodiverse child. And this is a really good example project. The Thompson Autism and Neurodevelopmental Center at CHOC, which is the Children's Hospital of Orange County, and they've since merged with Rady and become a larger children's health system. But this autism center was research-based. So it wasn't just somebody coming in and saying, this is how you design an autism center. There's always best practices and evidence-based design, but when you sit down at a table with those that are kind of science-based researchers on how the best care can be provided for this particular population, you get this really incredible vision statement that comes out of the people that are truly engaged and stakeholders. And so I love that they have right on their website, the goal of this center is to help children reach their maximum potential, no matter what it looks like for each child, in a supportive environment that cares for the whole family. I mean, if this isn't universal design at its core, I don't know what is, right? So there were things that were, thoughtful about even the way we put the planning team together. The lead planner has a child with autism, and so he thought differently as a designer because of that. everything, from the colors used and the art selection and the size and composition and the mounting heights on the walls was really thoughtful about how this particular patient population would interact with the environment and allow them to have a sense of autonomy and control. Even things like understanding what their life looks like in the community outside of the center and providing support for the caregivers and the parents that are involved, and how do we help train them to work with their neurodiverse child in a home environment that isn't a healthcare setting, and what does that look like, and what things can they be doing at home to kind of make their lives and their child thrive.
Yeah. So it's interesting you bring that up, because we at CIL, we work with home and community-based service providers. So oftentimes providers that are caring for people with intellectual and developmental disabilities. And so this was actually the topic of universal design, was a topic that came out of the Anchor Housing Task Force. It was, they were curious about how can they use universal design in those residential settings. And so I was wondering what your thoughts were on that. Like, how would you approach that?
Yeah, I think, we've talked about some key principles like equity. But another key principle in universal design is the concept of simple and intuitive. The design of a space should allow the person that's using it to understand at an innate level how to interact with a space without causing confusion or anxiety or uncertainty. And so it's a kind of a grandiose concept if you think about it, like, oh, make it simple and intuitive, but how, what does that actually translate to? It translates to things being clearly identified, to not introducing level changes in a residential setting, for example, for no reason. I mean, it's one way to, I suppose, break up a room division, but at the end of the day, it actually impairs movement and makes it more difficult for somebody that may have a physical impairment. It also influences those that may have a visual impairment too, though, because they may not be able to recognize that there is a kind of visual change in the step. I would also say that, all of our senses contribute to the way that we experience an environment, and even things like sound cues can matter. So, we're talking about residential settings, we're talking about healthcare settings, and there's a little bit of translation back and forth. But if you think about the use of water as a for example, and the idea that a water feature can actually provide a cue to somebody that may be visually impaired, that they've reached a kind of common public space, and that it's kind of a certainty that even though they can't see it with their own eyes, they know that they've reached a place of kind of common gathering. That there are similar arrangements that are made in residential settings, and the idea of kind of going back to the original thoughts of how home design started, the idea of the fireplace as the center of a home. There's a lot of reasons why that hearth became the center of the home, but if you think about the warmth and the light that is emanated from a fireplace, you can start to understand that it's actually speaking to multiple senses at the same time. So now you're feeling the warmth, you're seeing the light, you're maybe smelling the fire. You're kind of speaking to all of the senses and grounding somebody in a central location. And I think that that's an important part of how we approach universal design, more than just the obvious put grab bars in to help somebody who's not able to walk as easily, or eliminate step barriers where you can. I think the other thing about space that's always so interesting to me as well is how do we allow for the caregivers to thrive in the same environment without impeding that progress, and making sure that there's enough room for both of them to kind of thrive.
So we just ran through like the 20 minutes so quick, and I'm like dying to hear more. But we end every episode with this one question. What does an accessible future mean to you?
Yeah, it's a really bold statement, but an accessible future is an equitable future. It's one where accessibility is not an afterthought, but rather an integral part of the design process and how we approach the spaces that help us thrive and that we live in. It's going to give the gift of autonomy and choice to the people that are living in that environment, and providing them the ability to interact without, working around an environment that wasn't made for them.
I love it. Couldn't have said it better myself. Thank you so much, Carrie. And thank you to all of our viewers today. If you had other questions for Carrie, please comment them and we will figure out a way to get those questions answered. So
Absolutely. Thanks so much for having me, Sam. This was really, truly an amazing conversation.
thank you.